All right, so this is another example for the recording systems for the patient, which is called Emis. Uh, if you open your patient, which is Emis, so you'll find the patient demographic here. So the patient is called Minnie Mouse. He lived the usual address, household, who else live with him, and the map, the numbers, and the date of birth. The NHS number it will be here, and his usual doctors, and the warnings will be in this area. So if you need to add, if you go up and have a look on the second bar here, you'll find the summary, consultation, medication, problems, investigation, the care history, the diary, documentations, and referrals as well. So if you wanted to see this patient, you will need to put in your consultation. So you are on the bar of the summary. This is a bar of the consultation. So you will add a new consultation. And once you open it, it will give you the name, where you are, and it will come on like that. So how to document stuff. As we explained before, you need to document everything in accurate. Okay, so one thing I'm documenting today. So this lady had, let's say, chest infection, right? So she had low respiratory chest infection. So we are coding this one, and then you will find the history. Okay, so the history. How can I record the history? Everything, starting with everything. So the history, she is coughing for 3 weeks with fever, with night sweats and chest pain as well, and just an increase of coughing, but no coughing of blood. So always exclude serious stuff. No coughing of blood, no recent travel, no signs of DVTs or PE, something like that. Just rule out all the difficult situations. And then do not leave it here. So go for all the other stuff, with whom she live, and where she live, how she live, about the carers, she's having carers, anyone looking after her, all the situation there. And when you jump to the post medical history, give all what you know about the patient, right? In GP, it's different because there is a list of problems there. You'll find everything there. But if you're in the hospital, you will need to write everything, all right? Good. So the examination, specifically in GB, everything needs to be coded. So if you wanted to put the pulse, do not just write it. So just code it. So the pulse rate for this lady is 80. And if you wanted to put the saturation for this lady, you'll add it as, let's say, 99%. And when you put the chest examination, you will write everything as well. So you will say that Erin 3 bilateral is equal and no added sounds, something like that, right? And on the heart as well, you need to write so the heart sounds were normal and no added murmurs, all right? And when you examine the abdomen, say it's lax, no tenderness, right? If you're examining the lower limb, so say it's no edema and no signs of cuff muscles, tenderness, right? So you are saying there's no DVT signs here, or there is some redness and hotness, and it's equal with cellulitis, right? Family history, the social history, as we mentioned. So she lived alone with 4 carers, all right, or she lived in respite, or she lived in care house, wherever. the comment. So upon all, if we sum up to collect all the above, so you just mentioned, all right, so we suspected lower respiratory tract infection, and we will need to treat with antibiotics, which is will be amoxicillin, and or according to the guidelines, if she's allergic to penicillin, you will do something else. And for 5 days, and because she is so obedience exacerbation, they will add some steroid as well, and we will follow up the patient, follow up after 48 hours as per the CKS guidelines, right, or per your guidelines. And the safety net for every patient. So the safety net is given to everyone. So if you had any severe chest pain or coughing of blood, or coughing up bloods, so to seek medical advice. All right. So medication, if you just put on medication, it will come as a add-on prescription here. So you said you will add some amoxicillin. It will come as 500. So you will, how much you'll give it? You'll give her one to be taken 3 times a day for 5 days, and it's acute. It's by doctor, and issue. And when you put issue, it will be issued to the patient, and then you will put your PIN number, or it will go to the chemist or to the pharmacist directly. All right. The follow up, if you are arranging follow up plan, put it there, and the if you are doing any procedure, put it there. The test request, we had something we did discuss about. If you are test request, going online and put it. Here I'm Sheffield, so I'm putting Sheffield and choose your patient, this one, and we did show it in a single video how to request and what to request or what to add as well. Right. For the documents, if you need to add something or for the referrals, right. And after you finish, you'll find the save button there, save, so everything is saved. When it's saved, it will come as in consultation because you did consult the patient. So we did write every single bit. All what is it about here, it's documentation. We will discuss the legal point of view from this point, and the legality. When there's a problem, they will not go and ask the patient. They will not come and ask you. They will go and read your documentation. So your documentation must save you. So make it clear, concise, and with lots of no's that you don't think it is trauma, you don't think it's cancer. Why you don't think it is not? It is not. It's not. Put it in documents, please. All right. So this is one of the lovely systems which is used in GP land, and it's called Emis. Thank you.